So as Angela mentioned earlier this morning, here at BNI, we have what is called power teams. A power team is a contact sphere, and the purpose is to generate referrals. Making a plan for how referrals flow is the key to the success of a power team. To develop a profitable referral flow process, we would build a power team from the people who serve our ideal clients. This morning, we have a special presentation to represent this flow process within the health, wellness, and the beauty industry. We encourage you all to think if Nancy or her husband Scott might be a potential client of yours and how you might fit within this flow process. This morning, you'll hear from Dr. Christina Bagdanoff with Ageless Aesthetics, Dr. Erin Montgomery with Active Motion Spine and Rehab, and Sean Fletcher with the JWS Group. And first up, we'll hear from Dr. Christina.
Okay, give me a moment. So I'm gonna share my screen. Ooh. Okay, I think we're all good. Can y'all see? Y'all see this? Okay, so this is a joint presentation. We'll see how it goes, but I am up first. So I am Dr. Christina Bagdanoff. My business is Ageless Aesthetics and Natural Medicine, and I am a small med spa. So I'm a one room operation. This is literally my entire office. I'm also a one woman show. So that means I am the person who is answering the phones, I'm answering the emails, I'm the person who does the scheduling, I am the doctor who is signing off and approving these treatments, and I'm also the injector who is doing these treatments. So that means that for my patients, they're always getting really individualized one-on-one attention from me. And that means there's always 100% continuity of communication. So there's never any miscommunications between like like receptionists or providers or whatnot like that. So I am a doctor, I'm a naturopathic physician, and so I specialize in medical aesthetics. These are treatments that go in the skin and usually require use of needles. So my bread and butter is Botox injections. These are treatments that weaken and paralyze facial muscles. I do filler injections, which is really great for restoring facial volume. And I also do microneedling skin treatments. And this is a great treatment that can rejuvenate and replenish collagen in the skin, which is what makes skin stretchy and elastic. And so I provide all of these treatments that prevent, rejuvenate, and replenish factors that contribute to aging. So I'd like to introduce you to one of my patients, Nancy. Nancy is in her mid to late 40s. And she came to me because she was starting to notice this thinner, crepey skin texture, which is something that naturally happens to all of us as we get older because we're all constantly losing collagen in our bodies and in our skin. She also has this very active forehead muscle. You could see that when she animates, she gets a very crinkly forehead and she has really bouncy eyebrows. And so these were her main concerns. And so together we came up with a treatment that incorporated a combination of Botox and microneedling. And so after a few treatments, this is what Nancy looks like now. So we used Botox injections to help, weaken and, paralyze her facial muscles so that she doesn't animate as strongly. And in this photo, she is trying to animate her forehead, but you see that she cannot. And so that is what Botox does. And we're also using microneedling treatments to really rejuvenate and refresh her skin texture, her skin quality, and help stimulate that collagen production. And so while Nancy was in a treatment with me, she mentioned that she also has this recurring shoulder pain. So her right shoulder kind of acts up sometimes, and she also has some neck pain that goes along with that. And so while I don't do physical medicine, I know a great chiropractor who does. And so I recommended Nancy to talk to Dr. Erin, our chiropractor, and he's going to be up next.
Right on. I'm Dr. Erin Montgomery at Active Motion Spine and Rehab in Gresham. I run a rehab movement-focused clinic. It's not your typical rack and crack and place chiropractor type of thing. And so I was more than happy to see Christina's patient. Nancy, and we got her in. I was able to evaluate her neck, thorough evaluation. And it turns out that that aching shoulder and shoulder blade pain she was having was actually referred from her cervical spine or her neck region. This is actually quite common. I see it every single week in the clinic. And what we did is we found a directional preference movement strategy. It's called McKinsey method. It's widely used by chiropractors and PTs all over the world. So Nancy was able to do a simple exercise or repetitive movement with her neck that reduced her shoulder pain by 50% on that first visit. It was super cool. That allowed us to pick out a really useful piece of homework for her home care. And then I performed a few very safe spinal joint manipulations in her neck and her upper back. She left feeling considerably better. Now it's been a couple of weeks. The shoulder pain is completely gone. And the neck pain is probably 50 to 60% better by her report. She's doing most of her daily tasks with very little issue. She's been very diligent with her home care, which is important. And we are working on strengthening the muscles of her neck and upper back in the office 1 to 2 times per week for a couple more weeks, probably. Turns out her husband, Scott, had decided to get his aching lower back checked out in our office last week as well. Scott is an avid golfer, as am I, but had dealt with low back pain hindering his golf game for the last couple of years. He usually just pushes through the pain and then self-treats with ibuprofen, heat, and ice, very typical formula that rarely gets anyone better. My evaluation identified some core strength issues and lack of mobility in his trail hip, that's the right hip for you right-handed golfers, that was playing a large role in his low back pain. Because of those issues, he has been compensating considerably in his golf swing, creating what we call a reverse spine angle when he hits the ball. This is the leading cause of low back pain in golfers. He's a week into doing a very short routine of movements at home for core strength and mobility. And that, along with some spinal adjustments to his hip, his lower, and his middle back, have allowed him to hit balls yesterday with minimal low back pain at the driving range. Nancy and Scott are thriving again, and this is all because Dr. Christina was able to pick up on Nancy being uncomfortable during one of her appointments. So it was great to get her in and get that started. During a conversation with Scott at his last visit, he brought up, the end of the year is coming up, he brought up that their insurance will be switching at the end of the year, and they're both concerned that it won't have chiropractic benefits now. So I just put them in touch with my guy, Sean Fletcher, who is a pro at helping people figure out what will be the best insurance fit for them and their families and their needs. So I'll probably get to keep 2 awesome patients because Dr. Christina helped one of them find me, and I'm making sure they both talk to Sean to find insurance that will allow them to keep coming in for the care they need. Sean, it's all yours.
All right, thanks, Aaron. Hey guys, you've now heard about Nancy and Scott, their journey with both Christina and Dr. Aaron, and we have a physical therapist in the group too, Kelsey. Right? They work together. Right? All of our teams work together. On this little picture here, you'll see Dr. Aaron, you'll see Christina, you'll see Kelsey over there. You'll also see another one of our great team members in Whitney, right? Because she works for the American Cancer Society. And everyone knows someone who's been through that horrible situation. So everyone knows that they all the things, needs to know, I guess I should say, about all the great things they do for people, right? You'll also potentially see your face up here as one of our visitors. I did that because, well, we are growing this team. We need more folks. Nancy and Scott, as well as the folks they know, need other resources, and we need other professionals to be able to share with those folks. Right? This is what we call a power team. I'm a health insurance broker. I can dig in. I can help people make sure they have the right coverage when they need it. Right? I can help them through transitions of coverage when they go from one type of coverage to the other. I can do all those things, but that insurance isn't the exciting thing to talk about here. Right? It's our power team. It's how we can help one another, how we can help one client see all of us across their lifespan. Right? Not only do we have a power team here, a powerful power team that I hope everyone will want to be on, right? There's a lot of you in the health, wellness, and beauty team. But if you could flip to the next slide, please. That one right there. This, not only do you have a power team, You have the team, right? Northwest Connect at 9. You've heard a lot about us. You've heard from every single one of us now. Not only are we just here, we are in the community becoming better friends. Many of us call each other family, but we are a team. We are a group. We come together. We have coaches. We have life insurance agents. We have financial advisors. We have mortgage brokers. We have all these folks that when your clients, when your friends, when your family are going through something, instead of throwing up a post on Facebook, right, looking for a referral, right, instead of asking around and hoping and praying, you have real vetted professionals, people who know what they're doing, right, that spend time with each other, get to know each other so they can trust. Because in this world, we know, like, and trust. When we know, like, and trust folks, we can safely and feel comfortable referring to them. And that's what this is all about, right? Is helping one another grow our businesses together as a team. So hope you guys enjoyed that presentation.